Okay, seeing no concerns, we're going to move on. At this point, I'm going to turn it over to Bruce Davis, who is our facilitator for the evening.
Great, thank you very much, Jen. And I'm going to ask our panel members to turn on their video, if that's okay, just to make sure everyone's present and accounted for. I think we've got our team. Thank you very much for that background, Jen. Welcome everyone, my name is Bruce Davis and I'm your host and facilitator this evening. I'm a consultant working with the City of Kingston, HIV/AIDS Regional Services, and Kingston Community Health Centers to assist with community engagement on this project, and I'll be facilitating this online session tonight. As Jen mentioned, if you're participating through your computer, you'll be able to speak and type questions in the question section that we have later on. If you're participating on your phone, you'll be able to ask questions when we get to that part of the evening. Now, we had arranged for this to be live fed onto our YouTube channel, City of Kingston YouTube channel. I think we're just checking out some of the technical hiccups there. I'm hoping that we can broadcast live tonight. And afterwards, the video would be posted to the public engagement website. I'd like to start the meeting by acknowledging the land we're discussing today on Montreal Street is the traditional territory of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, and Kingston is now home to many diverse First Nations, Inuit, and Métis people. The purpose of tonight's session is to provide information to members of the community regarding the integrated care hub that's coming to 661 Montreal Street in November. We're here to share information, but also to hear from you, to answer as many questions as possible tonight, and also to take down your comments. We've put together a panel that'll be providing information, and as I said, we're recording tonight's session and making that available online through the YouTube channel. My technical co-host for this evening, you've met Jen Penarski, the City of Kingston, so she's helping with the Zoom technology, and she'll help us to turn your mics on and off at the appropriate time. In terms of the agenda, there's about 30 minutes of presentation, and then we're going to open it up to questions. Some of the questions have been pre-submitted, so we may start off with some of those, and then we'll get the ball rolling with members of the public. And as we get a little farther along, I'll explain how you can submit your questions either in writing or by using the online web. We will not be pre-screening your calls or questions. We really genuinely want to hear from you. We're just going to work our way down the list of questioners so that we can hear from you. Also, if you don't feel comfortable submitting your questions or speaking tonight, you can go to our public engagement website, which is getinvolved.cityofkingston.ca. You can submit your questions there. There are already a lot of questions that have been posted and the answers, so that's another vehicle for you there. If you're just joining us, again, my name is Bruce Davis and I'm your host and facilitator for this evening. I'm a consultant working with the City of Kingston, HIV/AIDS Regional Services, PARS, and Kingston Community Health Centers to assist with community engagement on the Integrated Care Hub, and I'll be facilitating this online session tonight. Our panel for this evening, I'm going to start with quick introductions. Ruth Nordegraaf is the City of Kingston's Director of Housing and Social Services. She'll be leading off. After that, Gilles Charette, the Executive Director of HIV/AIDS Regional Services. They're the primary operator of the Integrated Care Hub at Artillery Park and will also be the operator at 661 Montreal Street. After that, Mike Bell, CEO of the Kingston Community Health Centers. They've been providing health services and consumption treatment services at Artillery Park. And of course, they also operate street health downtown. In addition, we have other city staff on standby as resource people. When and if we need them, we can introduce them if we bring them into the meeting. I should also mention that Councillor Rob Hutchison is on the call tonight. Welcome, Councillor. And I should say at the outset, I've asked Councillor Hutchison not to speak until the end of the meeting, and it's a great opportunity for him to hear from us, to hear from the community, and then to give us his feedback at the end. I should also mention, I've just seen the name come up on the screen, MPP Ian Arthur is joining us. I see him attending, and I think he has another meeting to go to, but I just wanted to recognize you, Ian Arthur. Thanks for coming. So enough of the introductions. Let's get started with the agenda. First, we're going to hear about the city's overall plan for the integrated care hub and why it's needed, how it fits into the city's strategy for emergency services and affordable housing. And then we're going to hear from Jill about how HARS has been operating at Artillery Park and their operating plan for 661 Montreal Street. Mike Bell will then speak to the issues around consumption treatment and why that is so vital as part of this wraparound service. That should take us 30 minutes, and then we'll get to questions. So let's start things off. Ruth Norgraf of the City of Kingston Housing Services. Ruth, over to you.
Thank you so much, Bruce, for the introduction, and Jen for all your technical support tonight. I really appreciate the opportunity to speak about this project from a city's perspective, and obviously hear from you tonight as a community. As Bruce mentioned, my name is Ruth Nordegraaf. I'm the Director of Housing and Social Services at the City of Kingston. I also have two of my colleagues here, Joanne Boris and Mitchell Grange, who work in the Housing and Social Services team as well, and will jump in if there are any specific questions or comments that they will be able to answer. And before we kind of jump into the Integrated Care Hub project, which we are obviously going to talk about tonight and hear your questions from, I just wanted to talk about the role of housing and homelessness and the housing and homelessness system as a whole, just to put things in context. So our department, Housing and Social Services, is the so-called system manager of many of the human services in our community. And obviously housing and homelessness services are a very significant part of that. Our work in that realm really focuses on supporting members of our community that experience either housing insecurity or really need housing or affordable housing to make sure that they have an appropriate place to live. And our job here at the city is really to plan for and allocate funding to the services that we need across that continuum. So obviously that can range from homelessness prevention, emergency shelters, supportive housing, transitional housing, social housing, and affordable housing. And it really is not just a one-size-fits-all. There's many different tools to support people in that housing and homelessness continuum. And I know we all have been very aware of that over the last few years, but our housing and homelessness landscape has really continued to shift. Not only do we see clients really with increased acuity, their needs have been really changing, you know, on kind of the health and mental health and addiction side and the social services side. So our work really has shifted as well from initially really focusing on finding people housing. We're now suddenly also looking much more at how we stabilize people before they even would be able to access housing, and how we look at more of the bigger prevention of these situations. So that work obviously combined, as we also are all aware, with a limited availability of affordable housing in our community, we definitely have been, as a community, been seeing some increased issues around homelessness and vulnerable people. And as we as a city obviously are continuing to work on finding housing and building housing across that continuum, and I'm sure you've heard of a lot of other projects that we're working on with our partners, the situation has definitely become a little bit more complex and has expanded the role and the need to work together as a community. So as a city, we, as mentioned, manage that system, and as part of that, we always have every few years the ability to review the system and to look at you know, what works, what doesn't work, and how we can do better as a community. We were already planning that review for 2020 and 2021 prior to the pandemic. But again, as we're all very familiar with that over the last 7 months, the pandemic has really highlighted the vulnerabilities of the system. And we have many examples of people in very vulnerable situations, including encampments, obviously, more recently over the summer, or spring and summer. This is definitely not unique to Kingston, but it's our responsibility, I think, as a community and as partners to look at solutions. So with that, the integrated care hub that our partners, HARS and KCHC, and you will hear more about that shortly, kind of proposed to our community back in the spring, really is that additional and complementary kind of service to the portfolio of our housing and homelessness system. It's really a wraparound model that then will feed into other services such as shelter, supportive housing, treatment services, etc. As we also all know, we started with this initiative back in July at Artillery Park, which obviously always was meant to be a service for a few months, and council specifically asked partners to look at that for the summer months. So we already knew that Artillery Park would have to go back to its recreational facility ultimately. It was really great though to see that even in those few months, there were some amazing successes already seen with the model. And I should say that the community really came together. So obviously as a city, we were able to support this financially, but also other agencies such as, for instance, the United Way was able to generously donate funds for this initiative. And we had many other partners that either provided in-kind or financial support for this model. So obviously, knowing that Artillery Park had to go back to its original use, we did, council did ask us, knowing that this model really is working, to look at an alternative site. So what we did was, as a community, again, we worked on mapping out site options based on location, size, and service needs. And 661 Montreal was the most appropriate site given these requirements, and the availability, the timelines of getting it operational. So with that being said, City Council approved the move to 661 Montreal, and we have a lease until July 2021. And we do have an option to renew, but obviously that would be you still have to go back to council, and there would be, we would have to go through a public process and a planning process for that as well. So over the last 6 weeks, we were able to we saw an incredible collaboration between partners and various city staff on preparing the 661 Montreal sites. We are on track to move by November 1st. I know there's still lots of construction work that is happening. There might still be a little bit of construction work happening on the exterior after November 1st, but the site will be ready to move in, and we'll hit that timeline. As I mentioned, once the site is fully operational, we will be looking at kind of the longer term, and we will look at next steps. And as mentioned, when and if we would be looking at a more permanent site, we would obviously have to follow and will follow steps, and we will involve public and everybody that needs to be involved. So I can definitely talk for a few more hours, but I really want to hear from you. So I hope that was kind of an initial highlight of where the city's where this fits within the city's role and the bigger system. As mentioned, HARS and KCHC are really the main kind of operators of this site, and they are much more and much better suited to obviously talk about the programming. So I'm gladly handing it back to Bruce, and I think we'll hear from both Gilles and Mike after me. Thank you so much, and I'm sure I will be back with some questions to answer.
Great, thank you very much, Ruth. Next, we're going to head over to Gilles Charette of HIV/AIDS Regional Services, HARS. Gilles, your people, your team has been playing a key role at Artillery Park, and you're going to be playing a big role at the new site. So if you could just walk us through, and I know you even have some success stories that you can share with us, but over to you, Gilles.
Thank you, Bruce, and thank you, Ruth, and thank you to everyone who signed on for tonight's session. I look forward to getting your feedback and to sharing with you a little bit about the Integrated Care Hub model. But just before I do, we've received a few questions around, well, why would an organization with the name of HIV/AIDS Regional Services be a coordinating agency for this type of project? So I thought I would just give you a little bit of context into who HARS is and what we do. So since 1988, HIV/AIDS Regional Services, or HARS as we know it locally, has been providing support and education to individuals who are living with, affected by, or at risk of HIV/AIDS. And so one of the things that we know, of course, is that one of the modes of HIV transmission is through substance use, including injection and inhalation drugs. And so for over 30 years, we've been operating harm reduction programming. And in fact, we were one of the, we assisted in the creation of one of the very first needle exchange programs in the province, along with Street Health many years ago. And until the start of the COVID pandemic, HARS was operating out of our location at 844A Princess Street, a busy drop-in space that served some of our community's most vulnerable, and I like to say most resilient people. So we've been talking as a community a lot about, the pandemic that we're living through right now, the COVID pandemic, but HARS has been working during the COVID pandemic, but on two additional pandemics, the HIV/AIDS pandemic, but also the pandemic of drug poisoning that we're experiencing, not just as a community here in Kingston, but across North America, really, and other parts of the world. And so over the past 2 or 3 years, we've really seen an increase in the focus of our service on providing harm reduction services in order to help address some of this drug poisoning crisis. So our team has continued to work through the COVID pandemic, doing street outreach and trying to support individuals in the community who are camping or sleeping rough, and trying to provide them with practical assistance and helping to connect those individuals to other resources to help them out. And it was really as a result of that work that we began a conversation with the City of Kingston and other community partners, including KCHC, about the possibility of operating a 24-hour drop-in space for some of our community's most vulnerable. So the idea for the integrated care model that I'm going to share with you is really based on an existing model that is in operation in Kingston called the One Roof Youth Hub. Some of you may have heard of it. As well as leveraging some learnings from the Warming and Counselling Center, which was in place over the winter months until March. Now, both of these programs are operated by home-based housing with some support from other community partners. So the hub model that we're operating currently at Artillery Park and will be operating at 661 Montreal Street has 3 major components. The first is a 23-hour-a-day, 7-day-a-week drop-in space. We say 23 hours a day because for 1 hour a day, thanks to COVID, we have to do a deep and thorough cleaning to make sure that we're adhering and exceeding public health guidelines for infection control. But it's a space where people can come to experience community, enjoy nutritious food that's been provided by some of our community partners, including Loving Hands, Lion Hearts, and HARS's own food program. Where programs and services are available and brought to individuals who have historically faced barriers in accessing services. So whether it's housing supports, mental health and substance use supports, as well as primary care services and other wellness services. Our list of community partners keeps growing, but some of them are addictions and mental health services, home-based housing, Kingston Health Sciences Center, Providence Care, just to name a few. We've also, as I mentioned, been working closely with KFLA Public Health to ensure that we're meeting and exceeding infection control guidelines for these types of facilities and programs. So that's the first component of the hub model, is this drop-in space. The second component is a rest zone. An important part of assisting people with getting to a place of stability so that they can engage with other services, including housing, substance use supports, mental health supports, is rest. And so creating a space where people can enjoy some quiet for a few moments so that they can collect themselves, get centered, is really important. And so having a quiet rest zone is the second component of 3 in the integrated care hub. The third component is the co-location of consumption and treatment services. So CTS is the acronym that we use in Ontario. You might know it as an overdose prevention site or a safe consumption service, but it's really a place where individuals who use substances can do so with supervision from support workers, or in our case, support workers as well as paramedics. And it also serves to connect individuals who use substances with greater supports to assist them in their substance use. So between late June and early August, when we opened our doors for 24/7 operation, we quickly hired and trained 40 new staff and began reaching out to community partners to coordinate care and provide access to services in a low barrier model for the pilot that was meant to last until September 30th at Artillery Park. So from a philosophical perspective, the model is founded on 5 core pillars, and those pillars are harm reduction, stabilization, trauma and violence informed care, wellness, and cultural safety. So what all of that means is the approach that we're taking with this hub model recognizes that it's trauma that is at the root of many substance use and mental health challenges. And relational trauma occurs when there's consistent disruption of someone's sense of being safe and loved. And we don't have to look far back to just a couple of months ago in the summertime, people, being displaced, and not having that sense of stability and regularity in their lives. And this is a perpetual state for many of the people in our community. And that trauma can be compounded and reinforced throughout people's lives when they're faced with stigma and discrimination. And we know that that's certainly the case with people who are experiencing substance use and mental health challenges. So the aim is to really meet people where they are and work with them to avoid the unintended and unwanted consequences of their substance use. So ultimately the goal is to stabilize people by providing consistency of relationships, prioritizing rest, good hydration, nutritious meals, to get people to a place where they can engage with services that might otherwise have been out of reach for them. So now I'd like to share with you some stats about the hub. So since the hub opened its doors for 7-day-a-week operation, we've seen on average 250 visits per day. Thanks to our community partners, Loving Hands, Lion Hearts, and then HARS's very own food program, we've served on average 100 meals a day to the people that we serve. Individuals can access shower facilities, which is something that many of us take for granted, but really is an important service in order to provide people with a sense of dignity. Over 200 unique individuals have accessed the rest zone over the almost 3 months of operation, which is, a sobering thought when you're thinking about, people needing access to a quiet place where they can collect themselves. That's a really important service. Relationships are being formed between service providers and the people that we serve. The CTS, or Consumption and Treatment Service, is seeing more individuals through its doors, and frankly, lives are being saved because drug poisonings are being reversed as a result of the service being offered on site. Individuals are accessing mental health supports. People are having their medications reviewed, and they're accessing opioid substitution therapy, and people are accessing housing services as well. An example that was shared with me this week from one of the staff is that one of the great things about the community that's being created through this hub model is that people are actually helping and contributing to keeping the space tidy, so both inside and outside of the building. In fact, one of the individuals who's been doing this shared with one of the staff that for them, having a job of cleaning all day long, it's a meaningful task for them, has significantly decreased their substance use just as a result of having that meaningful work to do. And that was something that was bringing them a sense of pride and meaning. So, that's a good news story to share. And as well, it's important to note that the programs that are being offered are really being informed by an advisory committee that's made up of the people that we serve. So this is truly an instance of the team, and I really want to give a special shout out to the staff and the community partners who are working to pull all of this together. The team is really creating a model to fit the people we serve, rather than expecting the people we serve to fit a model that that is expected of them. So that's a really important paradigm shift. I think most importantly, I want to highlight that it's the relationships that are being formed that are really important. So as we mentioned earlier, many of the people that we serve have experienced a great deal of trauma, and that can make it difficult to engage and build trusting relationships. But due to the way that the hub is structured, relationships with service providers are being strengthened and individuals are accessing services that might have been challenging for them to access in the past, because there's a consistency in who you're seeing every day. It's the same staff, it's the same service providers, you're getting to know each other's names, and that's really important. Many people who have been unsuccessful in other programs are meaningfully engaging in the services that we offer, including our advisory group. We see older adults helping to mentor younger adults who are accessing the services, and the individuals are actively building a community of support around each other, which is really amazing and encouraging. So it's only been about 3 months, a little bit less than that. And with anything new, there certainly has been growing pains and adjustments, and we've learned some important lessons. So we're continually receiving feedback from the community, from the partners we work with, from the people we serve, and we've been making adjustments as we go along about how the program is offered and how things are structured. One of the challenges, frankly, has been using a space that was never intended for the purpose of operating a program of this kind. So while we are grateful for being able to use Artillery Park for this, it's really not meant for this type of service. That being said, we're really pleased to say that the model is working the way that we hoped it would. This is thanks in large part, as I mentioned, to the incredible staff we have there, the support we receive from our community partners, help from city staff, as well as support from Kingston Police. And none of this would be possible without the support of our funders, so the City of Kingston as well as the United Way. So our hope with the move to 661 Montreal Street is that we can continue to do the work that we're doing, engage more community partners in providing services to our community's most vulnerable, so that we can, work alongside them to get them to the place that they want to be at in their lives. Our hope is also to be contributing to the local neighborhood as good neighbors, and we're certainly open to building relationships with all of you and hearing from you about what you see is working and what you think we could be improving as well. So with that, I will turn things over back to Bruce, but I look forward to answering your questions.
Great, thank you very much, Gilles. I just want to pause for a second. We've worked out our technical details and it looks like our YouTube live is back on track. So I just want to welcome people who are watching through the City of Kingston's YouTube channel. My name is Bruce Davis. I'm your host and facilitator for tonight. We've already just heard from Ruth Nordgraf of the City of Kingston's Housing Services. We've just heard from Gilles Charette of the HARS, HIV Regional Services. And next up, we're going to hear from Mike Bell, who's the CEO of Kingston Community Health Centers, which operates street health and has been providing consumption treatment services at the Artillery Park location. And Mike, I know that today the CTS service is not approved for this site yet, but that's forthcoming hopefully. But maybe you could just speak to your successes and activities at Artillery Park and a little bit about the plan for 661 Montreal Street. Mike, over to you.
Thanks, Bruce. Absolutely, I will spend a few minutes speaking about the CTS. So CTS, Consumption and Treatment Services Site. Before I get into it, I'll provide a little bit of context that the CTS is part of Kingston Community Health Centers, and more specifically connected to our Street Health Center satellite. And over the past 30 plus years, really, KCHC has evolved into a multi-site and multi-agency, multi-program agency, delivering primary health care, addictions medicine, community health, education, early years, immigration, dental care, and much more. And our staff at Street Health Center and the CTS are widely recognized for their expertise in providing barrier-free access to primary care and addiction services. Starting in 2016, across Canada and definitely in Kingston, we saw a severe and sharp incline in opioid-related issues, such as emergency department visits, hospitalizations, and deaths. These figures continued to rise since 2016. So in response to the crisis, the province introduced the consumption and treatment services programs across the province. So our CTS is a harm reduction program where individuals can consume their own drugs in a safe and supervised and legal manner. It's staffed by community support workers and a paramedic. The goals and the essence of this program are to build deeper relationships and connections, much to what Gilles already spoken to. And it's so when we build those connections with our clients, these individuals are typically stigmatized in other healthcare and social settings. And so this is a big focus of the program. And when we're able to build that trust and build those relationships, the clients are in a better position to accept referrals to counseling and treatment. So I really want to highlight that that is the ultimate aim of a CTS, and it's to connect with our clients and facilitate their treatment as soon as they're able. And so therefore, the CTS is one part of a broader strategy. And I'm happy to say that the CTS has the support of the Kingston Police, the Medical Officer of Health, our hospitals, addictions mental health services, paramedics, and other partners. So if we spend a couple of minutes on why the CTS is a good fit with the Integrated Care Hub, we moved to Artillery Park for two reasons. First, we believed in the vision of the hub. And second, because the COVID physical distancing restrictions really limited our ability, we couldn't provide as much service at Street Health Center as we wanted to. So the experience of co-locating the CTS as part of the Integrated Care Hub has really been illuminating. When we were at Street Health, there were lots of successes, but we also struggled to optimize the service because some of our clients didn't necessarily feel comfortable using the CTS in a building where they also receive their counseling and their treatment. At the hub, with a drop-in nature, it's very conducive to building these relationships. Clients are able to stay for much longer, enjoy the food and the social supports and the showers and much more, as Jill spoke to. And at Street Health, there are multiple clinics happening all the time, and the space is quite limited in that respect. So within the hub, not only are the past CTS clients using substances in a safe and supervised way, but we have now welcomed many people who had never used the CTS in the past. These individuals were consuming drugs on their own, in parks, or elsewhere in the community. And I'm so pleased to say that now so many of these individuals are connected to Street Health Center's full range of core services. And this is exactly what we want. So finishing up with some good news stories, the numbers really do speak for themselves. We've seen a dramatic increase in the use in this new location, tripling the number of monthly visits in the short time we've been at Artillery Park. And we're now at about 500 visits a month. There are over 170 individuals who have used the CTS, and 51 of them are new to us since moving to the hub. So again, these were people who were using outside the CTS, which can be quite dangerous. And reiterating the fact that over 100 of those 171 people are now accessing Street Health Center and other addiction support services in the community, which again, this is really the ultimate goal. As I said, the CTS is one part of a broader continuum, and this is proven to be able to be a funnel to other services. So just to close, as you've heard, this has been a huge undertaking for everyone. I'd like to really thank HARS as the lead agency, but also the city who you've heard from Ruth, and they've done so much. The CTS staff, I really want to highlight the work. This is really tough work. We know it won't be perfect, but together as a community, I know we will learn and continue to do better as time goes on. So Bruce, I'll hand it back to you.
Thank you very much, Mike. So now to questions. And if you're just joining us, my name is Bruce Davis, and I'm your host and facilitator this evening. I'm a consultant working with the City of Kingston, HIV/AIDS Regional Services, and the Kingston Community Health Centers to assist with community engagement on the Integrated Care Hub, and I'm facilitating this online session tonight. If you're participating through your computer, you're able to speak and you can type questions, or you can put your hand up. There's a little hand raised thing that you push the button and then you go into the queue to ask a question. If you're participating on your phone, and I see we've got a few people tonight on the phone, if you press *9 on your phone, then you'll go into the queue to ask a question. And we're just going to work our way through the queue, through people who've already put their hand up. I can see there are a few hands up already. Just a reminder, you can also follow tonight's session through the City of Kingston's live YouTube feed, which will be posted after the meeting as well. Now, we've had a number of questions that were submitted in advance. We've been getting questions through our engagement site and through email. So I'm going to run through a couple of these very quickly off the top, just so that we can get these ones out of the way, and then we'll add to them through other local questions from the public. One question that we've had here, why was this site selected? And Ruth, I think you touched on that a little bit, but maybe you could just expand on that. Why 661 Montreal Street? Ruth, do you want to tackle that question?
Yeah, sure. Thank you, Bruce. So obviously we knew Artillery Park was not going to be a location that we could use too long and needed to go back to its recreational facility. We obviously had a list of requirements that we needed to look at, such as size, location, amenities available close by. So we had a list of kind of items to check off on our checkbox. So we worked with our real estate team and with partners, external real estate team as well, and did a citywide search in kind of the areas that we could look at for locating this service. And all of that combined really resulted in 661 Montreal to be the most appropriate location, also given keeping in mind availability and timelines to get that facility operational as well, in order to obviously move the services out of Artillery Park.
Okay, thank you very much. Ruth, while I've got you, I know this question comes up and I read about it in the paper as well. Will this facility be ready and open for November? That's a couple of weeks from now.
Yeah, thank you, Bruce. Definitely a question that's coming up. I know if you drive by, there's still lots of work happening on the site, but we will be ready by November 1st. The interior obviously is hard to see from the outside, but interior is pretty much ready to go. So yes, we will be ready to go by November 1st, while there might be some exterior work still happening after move-in.
Great, thank you very much for that. The number one question we probably get from the public through our engagement site and through the emails is about community safety. Needless to say, safety of the clients, the staff, and the community is paramount. And I'm just wondering, Jill, can you just speak to this? You're going to be the operator. You have experience at Artillery Park with this. Can you just speak to a couple of the community safety issues, and then maybe I'll go to Ruth after you, but let's start with Jill.
Yeah, certainly, and I think you've named it, Bruce. Obviously, as an organization, but also as a group of community partners who are working together on this, we're very mindful and concerned about security issues, not just for the people we serve, but the staff as well as the people in the surrounding area around the facility. I think one of the important things to note is that because the staffing model and the program runs around the clock, there will always be a number of staff in and around the facility to monitor the goings on. We also have cameras that are a number of security cameras that are being installed in and outside of the facility. And we've also got the benefit of having security staff outside of the building to monitor the situations. And between them and the staff, we also have a good working relationship with Kingston Police should the need arise for us to contact them for additional support, and they've been quite responsive. So, it's obviously top of mind for us when you're working with individuals who, many of whom have complex needs. It's something that you obviously need to be thoughtful about.
Ruth, do you want to jump in on that one?
I think Jill pretty much answered most of the pieces that I was going to suggest as well. So no, I think you did a great job in answering that question. Thank you.
Great. We have a few other questions that have been submitted, but I know we have members of the public who want to ask questions. So I'm going to suggest that we open things up. And I just want to mention a couple of things. If you'd like to ask a question, there's a raised hand button on your screen. Just push that, and then we'll see that you're in the queue. I have two people in the queue right now, Diego and Tammy. So we're going to go to you in just a second. If you are phoning in and you want to ask a question, just press *9 on your phone, and then we can open up your mic when we get to you. We're not pre-screening the calls or questions, obviously. So we're going to open your mic and you'll be able to ask your question. The question should be posed to the panel, and we'll try and get the right person to answer it. If you're asking the counselor something, we've asked the counselor to wait until the end of the meeting so that he can summarize and answer all the questions that may have arisen towards him. So I'm just going to ask you, if you want to ask those questions, we're going to wait on those. As with any meeting I facilitate, I always like to remind participants to keep their comments concise, constructive, and considerate of other views. The shorter the question or comment, obviously, the more people get a chance to speak. And I know that people have strong views about this proposal on pro and con, and then I just ask people to be considerate and not to use language that will further victimize the people we're trying to support through this initiative, or to use hurtful or hateful language. And I don't expect any of that, but I always like to mention that before we open things up to the panel. So we've got Diego. I've got you first on the list. If you just want to open up your mic, and then we will, if you just want to quickly introduce yourself and then ask your question.
Hello. Can you hear me?
Yes, go ahead. Yeah.
Hi, I'm Diego Natale, and I think well, I want to tell you, my property is at 665 Montreal, so I'm the person that is right next to this facility, and I'm a military officer. Also, I have a master's degree that I use, and I've been involved in very similar projects before. I used to work for the city. I'm coming here from Vancouver, BC. Now, it is fantastic, and don't get me wrong, but it's amazing that the City of Kingston is putting through this facility to help the most vulnerable in our community. It is very difficult and very complex to help those ones with mostly with mental issues and some addictions, and they need to be taken care of, because if the city doesn't do that, unfortunately they will end up dying pretty much. So I'm very happy for that, right? On the other hand, and it's very unfortunate, but it's a double-edged sword, correct? There is a correlation between the most vulnerable people in our community, and that they need to be protected and helped. And like I said before, it's great what the City of Kingston is doing. At the same time, as a member of the community, that I always look into helping the people that is in need. I've been suffering from vandalism since the congregation in Bell Park for 10 City this summer. And it is very unfortunate, because these people, and I don't want to say these people, the people that is in need in our community, unfortunately, they need counseling, and they are not in control sometimes of their actions. Therefore, there is a correlation between the most vulnerable and some criminal activities around. Unfortunately, I've been victim of just free aggression from, I live right next to my property is right next to there, and I also live very close from, I've been living very close last year from downtown too. And I found extremely aggressive people that from side effects and other complex issues and mental issues that they need help, but unfortunately they're aggressive too. And they do things that they don't know that they're doing, but like broken windows. I have people walking through my house, throwing a rock in my window, breaking the window, and keep walking.
Diego, I apologize for cutting you off. I know that there are other people who have questions, and you also typed this in. And I guess part of the question that you typed in at the end, kind of the punchline was, what's your action plan to contain and mitigate all criminal activities that correlate with drug users? That was part of, you posted that question.
Thank you,
I
Bruce.
just wanted to make sure that we got that question to the panel. So
correct.
if I could just pause you there. Diego,
correct.
Let's go to the panel.
I was building in to that. What is the action plan to contain and mitigate all those criminal activities that are associated or correlated with mental issues and drug users?
Great. Okay, so let's go to, my suggestion is that we start this one with Gilles and see, Gilles, do you want, this kind of falls on the question that I'd asked earlier, but here's a specific neighbor, adjacent property owner, very specific questions about what's the action plan to mitigate risks associated with criminal activity. So you want to take a first shot at that one?
Yeah, and I just want to start with, thank you for the question. I appreciate that you've signed on, and I look forward to the opportunity to meet you personally, Diego, if that's something that you're open to. And I'm sorry about the experience that you've had. I know that the summer was a challenging time in the neighborhood, and I hope that one of the things that I didn't mention about some of the measures that were put in place, aside from 24-hour staffing, security staff outside, security cameras, is there will be fencing around the property as well, which should help to a certain extent. I also really want to thank you for the empathy with which you've described the situation. It really does sound that like you really do have a good understanding of all of the issues and concerns surrounding this. And I do appreciate it. It sounds like, you are supportive of the work that's taking place, and you've got some very legitimate concerns. And so all I can give you at the moment are assurances that it's top of mind for us, and that we do have a staffing model that should allow for good monitoring of activities that are taking place inside and outside of the building. And that, again, we've got a good relationship with the Kingston Police Services should we need it, if we are unsuccessful at de-escalating a situation. Our staff are continually being trained on working with people with complex needs in order to help de-escalate things before they become issues. And I think that's one of the things that is challenging with situations like encampments or people sleeping rough, where they can't be supported on an ongoing basis. So the objective of the hub is really to provide that, really that round-the-clock support. So I hope that that helps to mitigate some of the experiences that you've had over the course of the last number of months. But certainly I look forward to introducing you to some of the leaders at the hub, so that you've got a direct line of communication with us.
Maybe I'll just jump in and mention I've worked on a few other projects not unlike this one, and one of the things that we quite often do is use crime prevention through environmental design principles to do a safety audit, which would include a walkabout. Once it's up and running, you can also look at things like landscaping and lighting and fences. So even though there is a plan for that right now already, it would be really great probably to do a walkabout with Kingston Police and the operator and the adjacent property owners. So that's a really, really good question that you had there. So my suggestion is we have other questions. If I could keep moving forward, if I can get the panel to nod, that would be great. I have Tammy next up. Now, Tammy, you've also submitted a couple of questions in writing, but we're going to open up the mic. So if you could just very briefly introduce yourself and then just ask your question.
Hi, I'm Tammy Lunn, and I am a neighboring person to the planned hub center. And I actually have a lot of questions which I'm posting online. So if you just want to address them through that process, that would be great. Thank you.
Great. Super. Let me just run through what I've got here. And if I've missed something, then we can open up your mic again. Is that okay? So one of the questions that Tammy submitted in writing, how many clients currently served at the hub, the integrated care hub at Artillery Park, are on the social housing waiting list? They're waiting for housing. How long have they been on the waiting list? And how long is it expected to take to provide them with affordable and financially sustainable housing? So obviously she wants to know, you know, what are we doing for a longer term affordable housing solution? Do we, without knowing the individuals, do we have an idea of the housing needs of the individuals who have been into the hub? Ruth, can I send this one over to you, or do we send this one? Let's start with Ruth, and then we'll go to Gilles. Ruth, go ahead.
Yeah, I'm happy to kick that off. Thank you. That's a really great question. And Gilles would probably have a little bit more info on that. I think really what, as we mentioned in the beginning, what we're really trying to do is initially stabilize clients in the hub. And to be really honest, sometimes housing is not on their radar even yet. And what really we're focusing on is getting them the right health support and the right referrals. For instance, sometimes rehabilitation or other services. So, but what we are doing, and as Gilles mentioned, we have partnerships with home-based housing and other workers. So if somebody is ready or is willing to put their name on the social housing wait list as one of the options, we would definitely, you know, obviously that's part of this idea. I guess, you know, in my introduction, and again, really good question, because it is really a bigger conversation. This is not a housing solution, as we all know. This is a place where we want to try to support people to then move into other solutions. So as a city, for instance, we're looking at building new projects of affordable and social housing across the community. We're trying to increase the availability of supportive housing models where people may need more support while they're moving into a more independent living situation. So unfortunately, I cannot give you an answer on exact like how many people and how long. The reality is we need to really address it as a system and add more projects to it. I think what I will do is hand it over to Gilles maybe to talk a little bit about you know, the people at the hub and their housing needs.
Thank you, Ruth. And yeah, I agree. That's a really good question. And I'm afraid I haven't got numbers at my fingertips right now. But what I can say, and just to echo what Ruth was saying, is that there are a number of different housing types, and then the individuals are at varying degrees of readiness. And so that's the objective of the hub is really that very first entry point into the system. And when we are able to assess, you know, with the people that we're serving, that there are, for example, you know, more conventional shelter type spaces that they'd be good candidates for, we try to connect them with those. If we know that, you know, they're in a place of readiness to engage with either supportive housing or independent housing, there are housing workers, primarily from home-based housing, who are on site to connect those people with those services. I want to share one quick example, though, from the hub, where sometimes it's just a matter of, you know, one important conversation that makes all of the difference. We have a mental health nurse that has been seconded to the site 5 days a week from Addictions and Mental Health Services. And that nurse was working really closely with one of the people that we serve, and over time was able to build a rapport with them, and they were able to do a medication review. Now, this individual has some mental health challenges, and as a result of the conversation, they were able to assess that the person was having a difficult time with knowing what medications to take because of some literacy challenges. And so making a simple change from pill bottles to blister packs, where all of the doses were, you know, were measured and timed, was able to assist that person to stabilize to a place where they could then connect with the housing worker, and they've now been successfully housed. So I think there's a bunch of variables, the variables around, well, what type of housing is appropriate for that individual, but also what needs to take place in order for them to be successful in accessing those different types of housing. So whether it's more conventional shelter spaces or apartments or supportive housing. And so as we know, there are gaps currently in the system that the city is working quite aggressively on. But this is really meant to, if you want to think about it as like, you know, triage. In a lot of ways, it's assessing people to say, okay, how ready are they? What are they at? And what do they need right now?
Thank you very much for that, Jill. Tammy's got a few questions. I'm just going to run through these, and then I'm going to bundle a couple of them up so that we can move through them, but some of them are fit really well together. So Tammy's another question is a report to City Council September 15th. Basically says Artillery Park has been operating at capacity with 60 to 70 overnight guests. And an additional 12 sleeping spaces were in the works. The question is, what is the current capacity levels for sleeping and resting at Artillery Park? And then another question is, for 661, what will be the capacity for sleeping and rest? So if we could just touch on that. Do we want to go to Jill on that one? So where are we at in terms of capacity at Artillery Park versus the new location at 661 Montreal?
Yeah, I'll kick it off, and then I think you know, Ruth may be able to chime in as well on this. So those questions are all sort of posed within the context of COVID space restrictions. And so, you know, over the short term, because of the physical distancing requirements, capacity of both spaces, Artillery Park and 661 Montreal Street, are impacted by the COVID pandemic and the need for, you know, infection control. And so, the numbers that I have are closer to 50 to 60 people in the evenings occupying the space on some nights, and that's between people using the rest area, people using the drop-in space. And so we can safely accommodate that number of people at Artillery Park. We've been working with the IPAC team, Infection Prevention and Control, with KFLA Public Health. We anticipate that capacity will be similar at 661 Montreal Street, but I haven't got the exact number at the moment. Our hope is to never have to turn anyone away. It's also important, though, that as I mentioned in the last answer, some instances, people who come to us can actually be successful in other types of shelter spaces. And so sometimes the work is actually just connecting those individuals to those spaces. And so that's part of the work as well, and part of the challenge. Ruth, I don't know if you've got anything to add.
No, I think that's great. That's a great connection that you're making there, Jill, because I was going to say, you know, this is, again, it's the integrated care hub is not the only solution. So we have home-based housing providing shelter spaces. We have the Kingston Youth Shelter. We have an overflow system created, again, in response to the COVID-19 kind of crisis. And again, we're looking at that bigger system as well over the next few months and see how it all would fit together. So we are quite nimble, and again, we're in a time that we've never been in before. So we don't know what the next few months will bring, as in kind of where we are with requirements with COVID. But definitely kind of agree with Jill that there is ability to kind of move between the different places as well, if we can. And ideally, we would like people to access other services if they don't need to stay at the hub.
Okay, so thank you very much for that, and thank you, Tammy. Tammy, I see that you have a few other questions. I'm going to just rotate around a little bit and make sure that everyone's questions are asked. So I'm going to go to a couple of other questions from other folks, time permitting, which I expect we will. I'm going to come back to some of the ones that you have. And I just want to remind our callers or people who are online, if you put up your hand, we can go to you so you can ask a live question. Or if you're on the phone, you can press *9, and then we'll see that your phone number comes up, and then we can go to you. I have another question here that was submitted in writing from Valerie. The City of Kingston has leased the property from November the 1st until next July. What is the cost of the lease per month? And I think we would go to Ruth on that. Yeah,
that's a great question. So the lease is about $10,000 a month. So if I do the math, that comes to about $120,000. Until July.
Great, thank you for that. Valerie had another question. Why was the community not contacted regarding this location in advance before it was chosen? So that's a question I think, again, Ruth, maybe I can go to you on. Why was the community not contacted in advance?
Well, that's also a really good question, and I can definitely appreciate that. So we did obviously under the kind of emergency requirements needed to move really fast, and we looked at a couple of different options. I know we went to council in August with a few options, and one of the options did fell through between August and September, and we also needed to really move forward. So. I think what we tried to do is definitely create a very, hopefully, open and transparent engagement process to make sure that after council selected or kind of really asked us to move forward with this, making this hub happen, to really work with the community. But we really did have to move really fast. So really tried to make sure that, that the community is and continues to be part of this and feels heard. But I can appreciate that moved very fast for people, and that decisions had to be made very, very fast.
Great, thank you very much, Ruth. I have a question from from Richard that was submitted online. Good evening. Thank you to all of the presenters for taking the time to share information about the hub, talking about the co-locating of services and how vital that is. But his question really is, how does this ICH model relate to a housing first strategy? This is from Richard. My understanding is that housing first approaches to homelessness have shown success in a variety of countries and settings, including in Canada. For example, will the City of Kingston's Housing and Social Services Department be explicitly involved with the ICH? So how are you approaching this as a housing issue? And how does it fit in with your housing first strategy? Ruth, you're the Director of Housing and Social Services, so we're gonna go to you.
I figured that would be towards me. Again, that's a really good question, and it's really good to hear that people are, obviously that you're familiar with that model, because it is a model that we've been very proud of, and it's been working really well for a lot of people. So we obviously are not, suddenly moving to a different model. This is an additional solution that will support really clients that are in more higher needs and more acute needs. Housing first, and I'm happy to share more numbers. I don't have them with me here tonight, but Housing First over the last few years, when we implemented, has successfully housed many, many people in our community, and people continue to be housed. So that will continue to move forward. And again, to Gilles' point earlier, I think some people, if they don't need to access the integrated care hub, we would rather have them access, for instance, a shelter, or maybe they can be housed right away. So our departments, where we obviously are connected with this hub in a couple of different ways. We are, for instance, funding housing case workers that work with home-based housing and help people to, sometimes it's homelessness prevention. People might still be housed, and they may need that extra help, and maybe the hub is a place where they feel safe and they would like to meet with a housing case manager. Also, for instance, we have a discretionary residency funds that we can help people with if there's any specific cost with a first month rent or last month's rent. So we as a housing, again, we have many partners around the table. I feel like the city, again, has been one of the partners. We're not leading this. Obviously, it's hers and KCC and many other partners that are really running this. I see that the city here is really just helping to make this a success. And obviously, we've been able to direct some funding towards this project to make it happen. Again, there's lots more to say, and I'm also quite happy to have an offline conversation about the Housing First model, and if there's any ideas. I think it's a great question.
Great, thank you very much, Ruth. Next, we have a live question from Jan. So Jan, I know you've also submitted your question in writing. I'm not sure if it's the same question, but we're going to open up your mic. So if you'd like to ask your question, or if you want, I can just read off of what you submitted. You go ahead, Jan.
Well, I heard Ruth just made a comment. She said an open and transparent process. And as being a resident of the North End, I kind of disagree. It was nothing open and transparent. No one in the North End had a chance to share opinions, share anything. We weren't asked. There was no kind of Zoom meeting like you're holding tonight. So it makes me feel very uncomfortable that we don't matter. These people definitely need to be housed. I 100% agree with that. But it's just a very uncomfortable feeling that we didn't matter. And you're probably going to disagree with me, but you said open and transparent process. There is nothing open and transparent about it.
Okay, thank you for that. And I know you also did have a question which builds on what you've just said. Do you want me to read out your part, or do you want to ask your question as well, in addition to that comment that you've just made? Jan?
Pardon me?
Sorry, did you also want to ask a question in addition to your comment?
Well, my main question is, why did nobody of the decision makers consult people or residents of the North End before making this decision?
Okay, so obviously we have an engagement process now, having made the decision to involve the community in terms of making it a success. So we're into that process now. Your question is, in advance of it going to council, why was this issue not raised earlier? I think we have touched on that, Ruth. I know you've touched on that once, but obviously this is an important issue for residents. Why were they not consulted in advance? You had multiple locations going into this site selection process. And this particular one, you went to another site first and then you went to this one. Do you want to speak to some of that decision-making process or how that works?
Yeah, I'm happy to respond. And I don't disagree. I think the reality is really timing, and we really needed to move this. We needed to find a location. We also had certain requirements regarding the location. So we needed to, obviously, we presented options to council and obviously the location is in the North End and is close to other services that clients are using. The one thing, and again, I think the one thing I do want to say, and this is just from a broader perspective, is we are working on a lot of different supportive and affordable housing initiatives across the community. I know this is in the North End, but we are also looking at initiatives in the West End and in the central city location that are also supporting a more vulnerable population. So again, I know that that's not going to help you and help you, and I'm sorry to hear that you're feeling uncomfortable, but we're really trying to work with the community to make sure that this model and the community feels that this is done well. And yeah, happy to talk more about that offline as well, but that's kind of what I can comment for now.
Thank you very much, Ruth. Next, I have a question. I have two questions from Kurt. I'll go to the easy one first, or the more straight ahead one first, and then the other one's a little longer, so I'll have to read it out. But the first question that I just wanted to ask, and this one is for Mike Bell. I think we should probably go to Mike on this one. Kurt asks, with the supervised, he calls it a safe consumption site, consumption treatment service at Artillery Park or at Street Health, have any clients been successfully cured, or I guess that's the way he's phrased it, of their drug addictions through the consumption hub? Mike, do you want to take a first stab at that question?
Yeah, absolutely. Hi, Kurt. As I mentioned briefly in my little presentation, we're really pleased that of the 171 unique individuals who have used the CTS at Artillery Park, more than 100 of them have been referred on to treatment and counseling. So, and if you break that down further, approximately 75 of those individuals are now on opioid substitution therapy, like methadone, etc. So really positive experiences with that. And without the access through the CTS, it's very likely that those individuals wouldn't have felt comfortable going through treatment. So I'm happy that you asked. There are a few other stories, and others that can tell them better than I can, of where clients are now in residential treatment. So cure is a big word, but we're definitely treatment, and some very, very strong examples here of success.
Great, thank you, Kurt, for that question. Does anyone else want to jump in on that? I can get to the second question that Kurt had. Is that okay? Great. Kurt had another question. The talks so far have concentrated on the intended effects of the community hub, the services provided, and the success with respect to usage. Nothing has been said about the physical and emotional safety of the people who live nearby. The Artillery Park location evolved over the summer into a virtual garbage dump. These are Kurt's words. A virtual garbage dump, a tent city, and a source of invasive, intrusive noise at all times of the day. Some of my neighbors were quite frightened of the area, and my son asked that we bypass it by at least a block anytime we had to walk by. What specific practices will be put in place to ensure that these issues are addressed? Now, I know that we have spoken a little bit about this earlier on in the program, but I know this is a recurring theme, and it's important for people to express this and to get the feedback. So I guess the question, I'll go to Gilles first, is what specific practices will be put in place to ensure that these issues are addressed for the neighbors? Gilles, why don't we go to you first on that?
Sure. I appreciate the question, and I certainly understand the worry, and it's one that we share. Obviously, we want everyone to be safe, and so without necessarily reiterating everything that was stated before. I mean, the space is staffed round the clock, which is different than in encampments, for example. There aren't people there to support all of the time. This space will be fully staffed. There will be security outside of the space. There are staff inside of the space. There will be security cameras and fencing. The staff are continually trained and coached on how to help de-escalate situations where if somebody's having a bad day and they're a little bit more agitated, they can help with that. And again, the objective of the hub is really to create a sense of stabilization so that instances like you're describing happen less frequently. And so sometimes that takes a little time because people have experienced some really traumatic events in their lives, and it takes a while to get to a place of feeling grounded when, for example, the community tells you can't be in this space, you can't be that space, you're not welcome here or there. Those are all traumatic things, but by providing people with some consistency and some safety and knowing that there's some relationships that they can count on, the hope is that some of the worries that you're expressing will be minimized. They can't be eliminated completely, but our team will do what we can and what they're trained to do to help to minimize those instances.
Great, thank you very much, Jill. And I have had a similar question, and I appreciate the recurring theme here. I had something very, very similar from, I think it was Tammy had another question. Yes, Tammy had a question. Neighborhood security, crime issues, vandalism, when the clients were at Bell Park. So I think you've caught that question there as well. Valerie has a question, another question from Valerie. Why do all of these services have to be in Kingstown? Actually, Tammy also had a very good question. It's very, very similar to this. It talks about the critical mass, really, of some of these activities, and why is this critical mass? It's currently home to John Howard, skills training, methadone clinics, home-based housing, Salvation Army. you know, you've got this critical mass. On the one hand, you can see that as a kind of a source of service for people, but the intensification is the question that Tammy's concerned about, and within really an 8-block radius. And her question was, myself and other residents are concerned about that kind of intensification and the nature of services that are growing and coming to this neighborhood. And her question is, does the City of Kingston intend to reevaluate neighboring property taxes if this critical mass, she believes, is having an impact? I know from having done work in other markets that, and especially in a very, very tight property market like Kingston, property values are not going to go down. But the question Tammy has asked is, does the City of Kingston intend to reevaluate neighboring property rates or property values? Ruth, do you want to take a stab at that one?
Yeah, for sure. I'm happy to address that one. And I mean, I'm not an expert in real estate, but the one thing that we do know is that I think as a city have a very strong, quite a strong residential property market, and we are also really seeing kind of, you know, honestly, I mean, we do see that property values have increased over the last little while. I mean, it's also, I mean, we do, again, believe with the model that we're creating and how we're also, you know, kind of looking at the broader community and how this is going to fit in the community. We do not at this point see that being an issue. Also, I have to say, like, the City of Kingston is not necessarily the body that is doing any property assessments. It's a separate body. I can totally appreciate the question, but at this point, based on kind of where we are as a housing market and property value market, I don't see that as something we would do at this point.
Thank you for that, Ruth. And I'm going to ask you one other thing. Tammy had another question, and it's really more about your broader housing strategy. Kingston and Frontenac and County of Frontenac have been awarded $3.6 million specifically to help homeless people during the pandemic. Why is this money being spent on duplicating existing community services and not on providing actual housing for our most vulnerable population? And I know this week you had another announcement at City Council. You've had several announcements this year on housing. Can you just take a couple of minutes to quickly run through maybe some of the top line housing announcements, things that you're already working on? It's not just the ICH, it's not just the integrated care hub. You are working on a multi-level, you know, like a broad strategy around affordable housing. Can you just speak to that briefly?
Yeah, absolutely. And also, again, happy to have a further conversation on that. But so we're investing money in a variety of things, and yes, we were very fortunate to get significant support for a lot of the homelessness issues that arose because of the pandemic. So we have spent some of the dollars that we've received, obviously, on the integrated care hub, but we've also been supporting the existing shelter system to move temporarily and to locations that allowed for more physical distancing. We have been investing in self-isolation services for our community. So those are all kind of monies that we've spent on kind of the more reactive initial kind of pieces. Sorry, and I shouldn't say the integrated care hub is a reactive one, but the kind of the short-term initiatives for the pandemic that we've taken with the existing shelter system. We also have been, actually quite recently, Council has allocated $11.4 million towards a housing development project on 1316 Princess Street, which will be developing 128 units in a range of affordability with fairly deep subsidized housing in that project as well. So that's actually the first time that the city has invested such a large amount of dollars in actually bricks and mortar. We've also purchased, and it's actually official now, but we've purchased 2 buildings, again, with a mix of municipal and federal and provincial dollars to create more supportive housing and affordable housing in one location actually in the West End and one location downtown. So So I would say we really are looking at that broader mix of housing and homelessness services. And the last piece I will add again is we get operating dollars on an annual basis from the province to support our homelessness system. And as I mentioned in my introduction, we are looking at that system and we're using all the pieces of all the lessons learned and all, for instance, the question around housing first, they're kind of putting all of that, all the different kind of programs. We'll look at how they all work together and how we can best continue to flow funds towards the various pieces of the system. So I guess it is definitely, there are definitely multiple pieces. And I should say for the Integrated Care Hub, yes, we are providing funding for that. I mentioned as well, we have the United Way that has generously provided funding to this initiative. And obviously by combining many partners, the idea is as well that, for instance, as an example, we would have people, staff seconded to this service rather than actually having to look for new money. We are looking at able to really build on existing models. And the One Roof model, which is focused on youth, is really a similar model where the actual cost is, you know, it's really a kind of a way of combining services and being more efficient as well.
Great, thank you very much, Ruth. And Tammy, thank you very much for so many of those thoughtful questions. I have two more people on the questioners list. I have Clara and then I have Andrew. And I just want to reiterate, if anyone else would like to ask a question, you can either type it into the question and answer box, and we're trying to work through everything there. I think I've gone through just about everything. And or you can put your hand up, or you can, if you're on your phone, you can press *9 on your phone and we can take your call in through the phone. So next up, I've got Clara. If you would like to ask your question, your mic is open. Go ahead.
Thank you. Thanks, everyone, for having this evening. I first just want to start, I think, by offering another perspective from the neighborhood. I support the building of the hub. It's clear that there are a number of unhoused individuals living in this inner harbor, and that the hub will serve this population. They belong in our neighborhood and they should be supported where they are at, with social services, a safe injection site, and a shelter for those who wish to use it. So kudos for the continued commitment to this project. I'm curious though, and you kind of mentioned or have talked about this, Ruth. So the City of Kingston has come out and has stated that they want to avoid a concentration of poverty within our city. And I'm trying to think of how to word this. You can't sort of deny the class dynamics that are, or you can't help but wonder about the class dynamics, why the Care Hub was put or is moving to where it is by the Open Data Kingston. There are only 2 neighborhoods within our city that have a low income rate under 20%. And so my question is, did the city ever consider moving the Integrated Care Hub into either of those neighborhoods, Alwington or Sydenham? If not, what does that say about the city's suggestion that they want to avoid a concentration of poverty? And as well, you did mention that community housing, there might be options within the city. I was wondering if you could say exactly what neighborhoods those will be in. And thank you so much.
Great, Clara. Thank you very much for your comments and your question. So Ruth, I think we go over to you on this, really about the concentration issue. And really, I know even this week you've had an announcement of a West End property. The Lower Union site is being developed, so that's obviously in a different neighborhood. So I'm just wondering if you want to speak to that issue of sharing the responsibility across the city and how we can all really play a role across the city in terms of supporting people who are vulnerable and supporting affordable housing. Ruth, do you want to speak to that?
Yeah, I think that's a really good question. And first of all, I'm really glad to hear, you know, that you are supportive, obviously, of this in your neighborhoods. And I know it's not, I mean, it is always kind of, you know, interesting to see how things will work out. So I guess from your question, a couple of thoughts. I mean, first of all, and I think we all tried to kind of explain kind of how the site was selected, and I appreciate that it feels like, you know, there's another service in our neighborhoods. Again, it was really a combination of site selection, availability, and also proximity to some other services. I think what I would say is, and Bruce just kind of already alluded to it, we are working on a multitude of initiatives. We are, for instance, also looking at, I mean, as you might know, Clara, as well, like we are working through our Rideau Heights regeneration project. So we created a plan for Rideau Heights to, again, obviously that location, that neighborhood was created with a very high mix of social housing. So the next few years, we're also working through, you know, changing that mix of housing in Rideau Heights. I know that's not going to happen overnight, and I think that that's the challenge with these pieces. It is a longer term strategy. So to Bruce's point, Lower Union, which is like across from City Park, has been bought by the city, and we're looking, you know, with our not-for-profit partners to develop that into supported housing. We have also bought the property in the West End with the same purpose, which is just close to the Cataract Way Center, to really focus on housing for people that need supports. So we are kind of looking at those different locations in town. Obviously, again, it's really depending on availability. And the last thing that I will say is, and again, without going into too much depth and too many technicalities, but we also have something called portable housing benefits. And this is a way of, if I might need some support and I need support with housing and paying my rents, we can help people obviously through the social housing list, and there is a process to that, with providing not a bricks and mortar unit, but with providing somebody with actually additional rent supplements kind of model. So quite often we might have people that are, you know, may not, you know, obviously don't know because of where they live, if they are lower income or not. So again, long story, I think the short of it is we are looking at a lot of different locations in our communities and different models of really kind of prevent, you know, one area to become the key kind of area. But it will take time, and it will take multiple projects and initiatives to get there.
Great, thank you very much. We're going to go to Andrew in a second. I had a question from Kurt in writing. It might have been helpful to have a police spokesperson at this meeting to discuss measures for community safety. Their presence at Artillery Park this summer was inconsistent. Some concrete planning and communications on this from the Kingston Police Service would be very helpful and likely reassuring. And I know that Kingston Police Service has been involved working with the partners we have on the panel, working behind the scenes. And I also know that they're making notes from tonight's meeting, and they've gone through, we had a meeting last night online as well, and Kingston Police Service are very much involved in kind of the project planning and implementation. There is not a Kingston Police spokesperson on the panel tonight, but they have been working with our operators. Would anyone like to speak to that issue? Because I know that they have been playing a key role. Who would, Ruth, do you want to just speak to the kind of how they've been coordinating with you?
Yeah, I will kick it off, and I'm sure Jill or Mike will have something to add to that as well. I mean, first of all, you know, we are obviously, the police has played a role in this, and Jill mentioned it as well. Like, we have weekly meetings with key community partners, and the police is part of that. Actually, I know, and to Bruce's point, like the police is obviously taking notes and is listening and is actually making some suggestions while we have this meeting. So I'm sure some members might we might have some follow-ups based on tonight with the Kingston Police. I know, again, Mike mentioned as well that Kingston Police has been very supportive of the CTS model as well, because they are seeing. And I know they are involved, and we all have mentioned it's not going to be perfect. We are working on this together, but the police is also really seeing that benefit of this service and the preventative and harm reduction model, because ultimately we all want to make sure that we care for each other and that we save lives, literally. I guess I can go on a long rant here on how important that relationship is, but I might pass it on to Jill or Mike for some other thoughts on that.
Okay, let's go quickly to Jill, and then I know we have Andrew waiting for his question, so go ahead, Jill.
I actually don't really have anything to add beyond what Ruth has eloquently shared.
Great. Okay, thank you very much. Next up, I have Andrew, who's put his hand up. So you've also posted a question online, but I'll let you, let's open up your mic first. You're welcome to read your question, or if you have another question, go ahead. Andrew, go ahead. Andrew, your mic is open. Why don't I start off by reading the question that Andrew submitted, and then Andrew, if we can get your mic operating, then you're welcome to join in after that. Andrew's question was, I just wanted to thank the city, HARS, and KCHC for their amazing work in supporting our most vulnerable community. How can community members support this positive work? So we did have this question last night, and it's always encouraging to have that question. So, let's start off with you, Jill. The question is, what can we do to help? What are the top 2 or 3 things that people can do if they want to help?
Andrew, I really do appreciate the question, and I also, it's a team effort. There's a lot of community partners who have been involved in making this happen. I want to give them the appropriate credit as well. There are a few things, very practical things that community members can do to support. One of the things is the practical supports that we offer, including the food supports, have all been done by donation. So when Ruth mentioned earlier, there are organizations seconding staff. That's certainly something that HARS is doing. People are bringing different resources to this program. One of them is food. And so the food that is being supplied has been generously provided through Loving Hands, Lion Hearts, as well as the HARS food program. Those are all organizations that would really benefit from financial support in order to continue to provide nutritious food for the people that we serve. So we would absolutely welcome donations. In fact, if you go to hars.ca, right on our homepage, there is a donation link there. There are also in-kind donations that we're looking for. We're getting into a colder season, and so things like warm socks, mittens, gloves, hats, always welcomed. New undergarments in packages that we can give to people, hygiene items, those are always items that they go out almost as quickly as they come in. And so that's an ongoing need. And I think, there will also be larger items that we'll have to fundraise for. Again, the food program is really central to stabilization for people. And so we'll be needing things like, commercial size refrigerators to store the food that's being brought to us from our community partners. We'll be needing things like, commercial dishwasher. So those are items that we're going to need to fundraise for. So something else that people can do is follow HARS on social media. That's where we tend to post our requests for donations or where we post fundraising events. So that's HARS Kingston on Facebook and Instagram. So welcome the community to follow us there.
Great, thank you very much. And I think with that, we have pretty much covered off the questions. There are a few questions that have come in that are very detailed, asking about staffing levels, asking if you have a psychiatrist on staff, like very thoughtful, detailed questions. And I'm going to suggest that the folks who've submitted those, you can also submit those questions to us by email, housing@cityofkingston.ca. That's housing@cityofkingston.ca. And then we can figure out who would be best suited to answer those. Some of them are very granular, very thoughtful, very detailed, and it's hard to just answer those right off the top of our head tonight. So if we didn't get to that question, you can also go to our engagement website, getinvolved.cityofkingston.ca. You can post your question there, and then after a day or so, we'll answer it, and you can see all the other questions that have been submitted. It's another really great way to get involved or to ask questions. And across the street, we didn't mention this earlier, we've opened up a community information office at 610 Montreal Street, right across the street from 661. And you can make an appointment to come in if you have other questions or specific things, or if you want to drop something off, if you want to drop donations off, we just ask that you make an appointment in advance. And again, you can make an appointment by sending us an email, housing@cityofkingston.ca, and that way we can meet you at the community office, which is set up across the street. So in a minute, we're going to go to the councillor to wrap up. But before we do, I just wanted to build on something that Andrew mentioned. How can we help? And the next item on the agenda tonight is really about how can we get involved? And the question is, I call it the Embrace Committee. And so going forward, as the Integrated Care Hub moves forward, people will want to be supportive. They are going to want to help in terms of whether it's fundraising or doing some kind of a welcoming function, or maybe helping with events, obviously in partnership with the service providers. We've had these Embrace committees. I've seen them in other parts of the province where people in the neighborhood want to be supportive. If you're interested in participating in something like that, I'm happy to help coordinate it to get the ball rolling. If you're interested in supporting something like that, please just let us know. You can write to housing@cityofkingston.ca. That's housing@cityofkingston.ca. And in the subject line, just put embrace, embrace. And the reason I use that phrase, embrace, is because we're looking for people who really want to wrap their arms around this, and people who need help and to be supportive. So if you're able and willing to participate, just send us a note and I'll follow up and get you involved in some way, shape, or form. And obviously we'll work closely with the folks at HARS and Kingston Health Centers. That would be really great if we could get you involved. So that's the pitch to get involved in Embrace. Andrew, you were asking a question, your mic wasn't working, so I read out your question. Do we have your mic working yet? Andrew, is your mic working? Let's try you again. I do not see your mic working. Okay, I don't see that. Okay, so last one, and this is going to be my last question now, so we can move on with the agenda. We have Tammy. You have asked a lot of amazing questions tonight, but we'll give the last question to you. Tammy, go ahead. Let's open your mic. I think we have Tammy. There we go. Are we open? Jen, can we open up Tammy's mic?
Hello?
Yes, there we go. Let's go. Tammy, last question to you.
I just wanted to make a comment in regards to the Get Involved Kingston website. I've been posting a lot of these questions on that site, and I have been not receiving any replies. I have copies of emails where I've sent the questions in and my questions are not being responded to. And it's rather annoying and frustrating, because as much as you're looking to involve community in your Embrace program, you also have to look at the community that's surrounding the area that also has to be worked on in building the trust that what's going to happen here is going to turn out okay. And when the communications are broken in that kind of way, it's very annoying. And like I say, it's very, very frustrating. And I actually know individuals who have submitted requests to be included in this meeting here tonight and didn't even get a registration for it. So I don't know what's happening on that front, but it doesn't feel like it's a very welcoming situation where you're looking for our input.
Well, a couple of quick things. I really appreciate you making that comment. When someone submits an email to the getinvolved.cityofkingston.ca, some of the questions we anticipate or we have them, and we know it's relatively easy to turn it around. Some of the questions you've submitted tonight are very, very thoughtful, but they're also very detailed. So it means that sometimes we need to take the time to check with the right people to make sure that we know. Now, tonight we had all the panel tonight, here, and we could answer on the spot, but sometimes we have to track down the individuals who might know. And of course, people are busy with running the integrated care hub, so it does take us a little bit of time. That's an explanation. It's not meant to be an excuse. And every question that comes into that Get Involved site, we do our best to get back. So I apologize for any delay. I do want to mention, though, we would love you to make an appointment and just let us know and come into the community information office. It's right across the street. If you're in the neighborhood, it should be relatively easy for you to come in. If you just write to us at housing@cityofkingston.ca, make an appointment, and we can sit down and go through. And you've put together a lot of information on this. You've already posed some very thoughtful questions, and we appreciate that. And don't be discouraged. Please do not be discouraged. This is moving quickly, but we want to get back to you as quickly as possible. So I just ask you to work with us on that. And I think we've now covered off. I have questions coming in. We have, I just had a note here about Tammy, many of the questions that you have submitted. I just had a note from one of our team that we are working those through, and because you've asked good questions, we have to take the time to get the answers right. And I think that's it. I have one last one, and I'm really trying to get as many of these in as possible, and then I really want to hear from the counselor to wrap up the evening. Valerie had one last question here. This was sent through email, has not been answered yet. The question here is from Valerie, really about is this temporary or is it permanent? And the fact that a COVID emergency regulation 141-20, this is Valerie citing it, has been used on a temporary basis. Now, according to Ruth, the lease has been signed until July 2021 with the option to extend. This seems like a permanent location now. So why isn't the Ontario Building Code being followed for its creation? I'm going to go to Ruth. I just want to make a point that the Ontario Building Code is being followed. The fire code is being followed. Your question, I guess, is this a temporary location or is it a permanent location? And I'm going to go to Ruth, and then we're going to go to Councillor Rob Hutchison after that. Ruth, you want to answer that question? Is this a temporary location or is it permanent?
Yeah, thank you. And Valerie, I do apologize. I did see your email come in, and I haven't had a chance to respond to you on that one yet. But yeah, it is a great question, and it has come up a few times. So I think we mentioned it a few times today. So the city has approved the move to 661 until July. We have a lease until July. We have an option to extend, but we don't obviously have to. And council really made that decision under kind of the emergency order that we were able to use for this, and again under kind of the COVID-19 situation. Once the integrated care hub is fully operational on this side, and we're also able to go through our broader system review, really when and if we do want to continue, we would have to go obviously back to council, and we would have to follow all the appropriate processes, such as a full planning process and a broader kind of public engagement. So yeah, that's kind of the status, really based on council direction and council approval until July 2021.
Great, thank you very much, Ruth. So Councillor Hutchison has been very patiently, studiously making notes, listening to the answers. And Councillor, we very much appreciate you being here. And let me turn the floor over to you, just so that you can give us your feedback and let us know what you're thinking. Councillor Hutchison, if you could just turn on just press your mute button. No, there you go. You're live. Go ahead.
Thank you. I just want to thank everyone for being here tonight, the presenters and the neighborhood residents and others. It's important that we get together and discuss this. I've been asked to do two things. The main one is what we have heard tonight. And I'm going to stress a couple of things that I think affect the neighborhood more than I might some others. We heard at the beginning how the integrated care hub fits into the overall housing system that the city is trying to develop, from homelessness through to transitional housing to permanent housing, and how the ICH helps to stabilize people who, if they can get housed, or often it's very hard to keep them housed. And that just get a revolving problem there. And we also heard that, that the ICH works as a, and I don't think this is well understood, that many of the people who are homeless have experienced trauma at some point in their lives, and that is what leads to some of their mental health issues, but more the drug issues, and that many of these people have multiple issues. And that's why you need highly trained staff, effective people to deal with them and nurture them along, hopefully into housing that will allow them to become self-supportive people. We heard that there was 250 visits a day to the integrated care hub, which is far more than we expected. And that's going around. And so they have a model that's wraparound need. They're going to adapt the program to the needs rather than expecting people to do it the other way around. And the participants actually help out each other and the programs. So we also heard that this is not new to our city or our neighborhood, unfortunately. We've had drug issues for quite some time, but in particularly since 2012, we've had an opioid crisis, which has been followed up by worse drugs like fentanyl and crystal meth, and which end up in emergencies and death, frankly. And that happens not just in Kingstown, but in other areas as well. And I think that's not well understood. And goes under the, people don't see it. So, but we do know the ICH is working. It's a really tough job, but it is working, and it works on the ability to get people's trust and get them to move along in a self-improving sort of way. So that brings us to the questions. There's a certain perspective sometimes that comes with being a counselor, and we were asked why this specific site. I want to take you back to March, the middle of March, when the province declared an emergency, and then the city soon after declared its own emergency, and under the guidance of public health. And I want to remind you how frightened, afraid even we were. We didn't know what was going to happen. The city didn't, and public health probably knew more than anyone, but city was having to deal with new threats and problems, and trying to work out what we were doing and how we would deal with it. So the specific site at 661 Montreal starts way back to Bell Park, and then the city decided that wasn't working. And I think you've heard from residents tonight how that isn't working. And I have many, many inputs from residents about that. And that's why I supported that closure eventually, happened eventually. But I also agreed we had to do something about homelessness and the drug and mental health issues that were feeding into that, including, and not, as I think we all know, simpler poverty. So the artillery park was brought in as a temporary measure, as Ms. Nordegraaf pointed out, and it wasn't ready until July, and so it didn't seem right to have asked people to move and then have nowhere to put them. It took a while for the hub to get operating, like any other operation, and to be as effective as it can be and has become. So in August, we had staff, August 11th, staff told us they'd found a place at 342 Patrick. So the city proceeded to do that. Now you have to remember that there was an epidemic on, there was time constraints, and from a council point of view, we were giving a series of options that were not options. There were choices, and there was one choice. First of all was 342 Patrick. It didn't end up there. Then staff went to Plan B, 3 locations, all very close to 661, 631 being one. And so any votes or decisions were really not really choices. There were what staff would be able to find in the real estate market that met the criteria. The criteria were it needed to be central and downtown because that's where the clientele is and they're available to them. Also availability, accessibility, affordable, and size that would allow us to do the hub in a proper way. Because there's no point in doing this if we don't do it in an effective way. And I would strongly suggest that the hub being effective actually will address some of these issues around safety and security. All during this, I kept telling staff, look for an alternative location. Is there an alternative location? And they did. I believe they did. I've seen the reports. And there just wasn't anything left in the end. And if you think about it, I've racked my brains going up and down streets thinking, well, there's this, well, about that. And really, there isn't much there. Some landlords refused to let to the city because they had other plans or they didn't like the purpose or whatever. So that's important to know. Now, we've also heard about security. We've heard that there's some of it's physical, lighting, fencing, the brush is being taken away so that there's clear sight lines. We have in the hub, there's trained and experienced staff used to dealing with crises and problems. And that I think is really important. The police have been engaged at Artillery Park and again at the 661 Montreal, they're not that far away. And I believe that they will be there if we as residents need it. I also wanted to say that I have all along and also said and encouraged increased security and with senior staff and the services because they need to all work effectively and it has improved. I think Mr. Charette can tell you that with his staff and himself and the police and senior staff, things have improved. That doesn't mean there are no incidents, okay? Occasionally there are, but it's way better than when we started. I honestly think when we went down to Artillery Park, we underestimated what the fallout would be, to be really truthful about that. We've never done it before. We were in a rush. We had to get it done. Now, Artillery Park is temporary. Why? Because it's a recreational facility. It's in a quite dense residential and business sector, and we need to get out of that site. So now there was an interesting one. A couple last things is it was brought up. that it wasn't an open and transparent process. And I think the answer from Ms. Nordegaard that no, it really wasn't. I mean, in some way, maybe yes, but not really in terms of consulting the public, which is what we usually do, and was a planning process. Partly that is because we have a pandemic emergency still going on. People are still getting sick. And if we didn't practice, and I thank all citizens for this, practice the right protocols, be a lot more of us, and we'd have problems in our hospitals, as is happening in other parts of the province. So now, there were public reports starting way back March, April in particular, about the situation in Bell Park and what we were going to do and where we would go. But that really only comes for in, July 7th and August 11th. And then the story in relation of events that I told you earlier comes into play. But I do appreciate that it feels, tough, and I understand people's apprehensions. It's for real. So there's another general question, which was really interesting. Why not Alwington Place? Why not Sydenham? Well, I think we know the answer to that, but it doesn't make me any happier than it makes you. And however, Ms. Nordegaard properly pointed out that over the last time, the time that I've been on council, there's been a lot of public investment in the North End, depending whether you count north of Princess Street or north of Johnstown Boulevard, whatever terminology you want to use. And that includes housing, rejuvenating Rideau Heights, 850 Ridley Drive, 1316 Princess Street, all relatively recent and still in the pipeline in some cases. So I think it's really important to see that has this been the best of processes going back 25 years? No, it hasn't. Is it better now? Yes. Is it better that there's an integrated care hub? I believe yes, and we're hope for the best that it will improve things and make people more secure, more on a line to being able to be assisted and assisting themselves. But I won't lie to you, will there be incidents? I think there will be. So I mean, really pressing senior staff to have security not only in the building and outside the building, but in the neighborhood. The police are there, but I think it may take something more. We're going to have to see, and right in front of the staff of the hub and senior staff, I've said exactly that more than once, as they will attest. Okay, so I'm doing my best to look out for you, and so are the people that are present today doing the presentations. They really believe they're not fooling around. They're really serious. They're professionals. They really think they can do this, and they think it's best over the mid to long term. Will we be looking for another location? Well, I've asked that that be the case. It still has to be evaluated. Is it temporary or permanent? Well, it does have some earmarks of permanency. I think we can all agree. However, that it's just a fact that this building will have to pass certain building code inspections and planning processes where the public will be consulted, and the program has to work, has to satisfy any number of staff and council that it's working. And so in that sense, and we don't know if there's going to be funding. So in that sense, it's temporary. As I said to one person, one resident, it's a bit of both. So that's why you get sort of not quite answers from staff and others not quite sure. It depends. Come July 2021. So I wanted to say one last thing. I don't want to go I'm trying to keep this short. If you have any concerns about this, any thoughts on this, you can contact myself or Ms. Nordegraaf or both, and I will take your concern and contact the appropriate people, either in the housing department or other departments. I guarantee you I will do that. You can phone me, and it's on the city website, and we'll see what we can do. And I'll just say thank you for coming. And as I say, if you have any questions, other questions, further thoughts, please let me know. Thank you.
Thank you very much, Councillor. And we're going to bring tonight's meeting to a close. I should also take a minute to thank our other panelists, Ruth Nordegraaf from the City of Kingston's Housing and Social Services Department, Gilles Charette, the Executive Director of HIV/AIDS Regional Services, and Mike Bell, CEO of Kingston Community Health Centers. Thank you for being on the panel. Thank you also to the technical co-host for tonight, Jen Pinarski, and I know Jen is going to take over in just a second. Just a reminder, if you were not able to get your question in tonight, you can write to housing@cityofkingston.ca, and you can also write to us there if you want to make an appointment to come into the Community Information Office, which is at 610 Montreal St. So please, or we also have that engagement site, getinvolved.cityofkingston.ca. So you can go there to give us your feedback and input. And now I'm going to turn things back over to Jen, who is going to do a little follow-up at the end of the night.
Hi, everyone. Thank you again for joining us. Bruce captured all of the ways that you can stay connected to the project. Because online public engagement is new to us, we really do want to hear about your experience with the technology tonight. So you will see an evaluation poll in front of you. We also recognize there were some concerns with how the live stream started this evening. So our commitment to you is that we will keep you updated and we'll let you know when the full recording with closed captioning is posted. I'm going to leave this evaluation poll up here for a few minutes. But again, on behalf of the city, thank you very much for joining us. And it looks like everyone has completed our evaluation poll. So thank you very much. We are going to conclude our webinar and the live stream. Thank you again.